Time now for another edition of Ask the Expert. And today we are talking about your mouth and keeping it healthy. Trillium Dental is taking your calls and emails this morning, and Dr. Mark Northcott joins us live. Dr. Mark, good morning to you. Great to see you again.
Good morning to see you too.
Great. Okay, so there's so much to talk about. Our mouth, our health. You know, if you have a healthy mouth, healthy gums, healthy teeth, that helps to lead a healthier life. And so we got to talk about oral hygiene, first off, and talk about ways in which we can keep our mouth clean and healthy.
Yeah, it's funny. The general consensus I think most people have today is they're not so concerned about oral health. I think they put it as a second tier. You know, the medical health is important, and dentistry or dental health, it's not as important. I find that from a lot of patients. Really, there's so many studies out now today that show that how important this is. Approximately 50% of the patients in North America today have periodontal disease. And what that basically is gum disease or pyorrhea, depending on what you want to call it. And there are some serious medical links now that are coming up in the literature regarding that. You know, they've linked high blood pressure, cardiovascular disease, respiratory disease. There are links to dementia. There's dementia links to Crohn's. What they're saying, the studies, is that the periodontal disease doesn't necessarily cause these conditions, but is a cofactor. Think of it, periodontal disease, basically as it's an ongoing infection. And long-term infections are what are the cause, are the concerns. So any time you have an infection in the body and it's not treated and it's ongoing, it can cause issues. Specifically, the mouth is one area where, as I said, periodontal disease is quite prevalent in the North American population. What we tried to do over the years is to educate the public and their need to come in and have regular oral care. Typically, someone who's got gum disease should be in the office every 3 months for deep cleanings around the dentition. If you're perfectly healthy, then every 6 months is adequate. What I've noticed in the last few months, especially during the COVID situation, is a lot of patients obviously have foregone their dental treatment. Yeah. And the incidence I'm seeing now of periodontal disease and just general tooth decay is significantly higher. And that's a concern. Dental offices are extremely safe. You know, there's no noted transmission from doctors to patients in the literature at this point in time. It's probably safer than going anywhere else. So it's very important patients try to maintain and continue keeping those appointments. Dental disease basically is a bacterial process. And what happens over a period of time is once someone's had their dentition cleaned, within about 3 months after they've had their dentition cleaned, the bacteria starts to change in their mouth. It builds up and sticks to the roots of the teeth, and eventually goes through a metamorphosis where it changes from one type of bacteria to another, which eventually causes bone loss and causes this ongoing long-term inflammation of the gums. So we want to kind of keep it under control. And one of the best ways we can do that is with regular dental cleanings and hygiene. And seeing a hygienist if you've got gum disease every 3 months is critical. How do you know you have that? Typically what we do is we do a comprehensive exam. And part of a comprehensive exam is periodontal probing. We take measurements around the teeth, and those measurements will give us an idea at what risk level you're at. You know, 1, 2, and 3 millimeters is fine. When you get to 4, 5s, and 6s, and you have generalized bleeding, these are areas of concern. So I think that's one of the most important things, is obviously coming in for your regular hygiene to mitigate those risks. The other thing of concern, obviously, you want to make sure that part of our hygiene process is to make sure that there are regular records that are taken. You know, regular x-rays every 12 to 24 months is what's recommended, depending on the patient's dentition. Some patients maybe require more frequent, some may require less frequent. So the constant monitoring is key. The issue here is that when you get decay, it progresses, and usually about a 6-month interval. And if you catch it early, it's usually an easy fix. If you catch it late, you're often losing teeth, you're often needing root canals and more advanced treatment. So there's no better time than the present to treat something. It's the simplest time to treat it. So, you know, regular radiographs are very important. The one limitation for dentists is that an x-ray, you need about 30% of the decay on a tooth before you can actually see decay on a radiograph. So in combination of radiographs, there should be a comprehensive or a regular examination by the dentist on a regular basis to check. So the combination of an exam and radiographs are really important to give the patient an idea of what's going on, the dentist an idea of what's going on, so we can organize a proper treatment plan to take care of your dental needs.